Hi everyone, welcome to CodeMed. We're taking med moments to long form, 10-minute quick conversations with healthcare leaders where I get to ask them questions about their role in the patient journey, their answer to which would be very useful to our growing audience. This episode, we talked to Melissa Grant, COO of carafem, a women's health provider that grew from one brick and mortar to a nationwide service via telehealth. We asked Melissa the keys to outsourcing in healthcare. Take a look. Hi, everyone. Welcome to CodeMed, UPIC Health's medical podcast. I'm here today with a very special guest. Today, we have the COO and founder of carafem, Melissa Grant. Thank you for being here. How are you?
Great. Thank you so much for asking me.
So Melissa is a really awesome person, awesome entrepreneur and health advocate. She founded carafem in 2013. And carafem is an organization that is known for its person-centered approach to sexual and reproductive health. And you have really grown this from the bottom up, and they provide everything from online consultation services to in-person care. I'm excited to get to ask about this.
Thank you. Thank you. I'm happy to talk to you about it. It's been a true labor and also joy in my life.
I want to, talk about, your kind of work as an entrepreneur in this, already controversial business. How does the outsourcing become part of the business model? And how do you ensure that the people you're bringing on board are aligned with your values and your, levels of discretion, all that?
Ultimately, even though we're a nonprofit, we need to be able to assure that the business model can sustain itself to keep our doors open, right? So it's that idea of being a small business and thinking about how do you run that business, but also making sure that we're doing it in an ethical way that shows that the people we work with believe in our cause enough to be supportive and to work with us openly. But then also looking at nonprofit work as a business and realizing that part of what you do when you start a company, I started this company with two of us. And as we started to build, it didn't make sense to bring on a full-time person for all of the things that I needed to be able to accommodate. And it was about building these relationships with similar-minded organizations and vendors who said, we want to help. And as we grow, many of these organizations have scaled with us. And some have dropped off and we've brought on new ones. And I feel very good about the relationships we've established along that journey.
What are some of those relationships or like areas where you outsource?
It was important for me to bring on organizations that did things like payroll, that did things like human resources. I mentioned our contact center, the folks that answer our telephones. I brought on people for security. There's a gamut of folks that did some of that back office for me, some of the accounting features. And as time has gone on, for instance, now we have our own full-time accounting staff. Now we have our own medical staff that are full-time positions in some of our locations. But we still use contract folks for some of that. And some of the organizations just feel like part of our family. They've been with us since day one.
So they've really been a part of how you've successfully grown this business.
They are part of the carafem family and they are part of the important decisions that we make.
I feel like a lot of fear that comes with outsourcing is that you're compartmentalizing a little. You're worried about, outsourcing a little too much and, losing too much control. I find it interesting you say because obviously your relationships, they sound very close.
They are.
So how did you make that happen?
Part of it is that very candid conversation at the beginning about what we need with an eye toward we want to be able to grow. This is where we are now. This is where we want to be over time. And do you buy in? And so it was more than just what skills do you have right now? It was really about that culture of the organization and having them understand that and hopefully buy in. So whether you're a full-time staff member or you're a vendor that works with carafem, we're always looking to a results-oriented process and talking about it openly. Here's where we are. Here's where we want to be. If you don't like change, we might not be the organization to work with.
That's a fair warning. I feel like going in, you might hear that before. But again, you're an organization that changes. You're evolving, and I think a lot of that it sounds like a lot of that comes down to keeping a tight wrap on your relationships. And these external relationships that you have, how do you think that that's been a positive in terms of, focusing on the actual care you provide? Because I also know that your customer satisfaction is
very high.
It's very high. It's very high. And you've been around over a decade. So It's really incredible how you've upheld that standard. So does outsourcing and just having those partners allow you to focus on what's in front of you in terms of the care and the people you provide care for?
Certainly to some degree. I mean, I've got these organizations that are well established in and of themselves and are able to give me a portion of what they do without relying on an organization that's still scaling to pay the same amount as I would if they worked for me full time. And so to some degree, that allows the very best of the time that they are with me to be focused on me. They're not as worried about where the next paycheck is going to come from because they've spread it amongst other organizations. It's that shared service model that, whether they're my employees and they're working for somebody else or they are working for their own organization and I'm sharing them with others, that model can work. But again, the keys to it are that communication and shared understanding of where we're going, results-oriented work. And it doesn't work with everyone, but it certainly can.
Sounds like there's, the big element here is, having the personal relationship. I feel like the image of outsourcing doesn't include a lot of communication, at least in my head and with people I've talked to about it. But you've been able to like rein that in with that result of communication.
In my opinion, that's the secret sauce. That's really what makes the culture of the organization work with the people that you work with, is that sharing of where you want to be. It's having that high ideal.
Is outsourcing a long-term strategy for you, or can it be a long-term strategy for people looking to do that?
But let's put it this way, it depends on who you're working with. There are some organizations that may be doing a part of the services for you that are wanting to stay within a certain niche and they may not be able to expand. And if you're expanding, you're scaling your business, sometimes you do have to part because it's like, okay, I don't function at this level. My set is this smaller size, the smaller capacity. And that's okay. There are other organizations that grow with you. Or there's others that say, I see where you are and I can help you get where you want to be and then I can function with you. Part of the key, though, is that hopefully as you're building that time, if there are economies of scale, that organization that's working with you realizes that and potentially also says once you hit a certain volume of clients or a certain volume of service, that maybe we can work with pricing in order to make something work better for you because it becomes less intensive the longer you work together. So It can work either way. It can be growing together. It can be an amicable parting when there's a better fit, or kind of figuring it out as you go and growing at the same speed together.
You just have to keep on top of managing those relationships and assessing the benefits of those relationships.
Results oriented. Stay on top of those results, stay on top of those relationships. And for us, at least, I think that's been the key to continuing to have success.
I guess what would you say to kind of destigmatize the process of outsourcing and finding external partners? What would your advice be to someone considering doing the same thing?
Agreeing clearly on the common goal. I mean, it needs to be something where you are both very clear about the results are that you're wanting, having those candid conversations about when that's not happening and how to get there so that you're sharing that information, treating each other with respect. So it's making sure that you're treating each other the right way. And if something's going wrong, addressing that. And again, if it doesn't work, it's okay to cut your losses. It's okay to say this particular relationship isn't working, but it's not okay to do so as a surprise. It should be an ongoing conversation and done with dignity and respect. The fact that we happen to be an abortion care provider, I think in some ways helps us to realize the importance of those relationships even sooner. Because for some people who may be politically sensitive to the work that we do and not want to work with us, that's fine. I don't want to work with you either. If you don't believe in this and you can't do this, it's okay. You're not the one I want to talk to.
Right. I mean, carafem, there's a very specific vision. So whoever you bring on board is to share a vision. I think that, like you said, that's a universal thing. You have to have the vision. You have to have the communication.
Great. This one particularly so. It's okay to work with us peripherally if you aren't going to be an outward supporter and, you don't have to be a donor, but you can't stand in the way and you can't disparage the work that I do. And you certainly can't do anything that would impact the client because that's my reason for being. So if you can't do that, if you're going to hinder that relationship, this isn't the right place for us to work together.
I have one more question for you, Melissa. Can you explain to me why carafem is spelled all lowercase?
Absolutely. When we built carafem, the idea with the team was that we wanted to have an external focus on the people who needed our care. And you'll notice that we don't call the people that come to us patients. because patients are generally sick. We call them clients because they have a choice as to who they want to come from. And we know that we need to meet that expectation with service delivery. That's why carafem is spelled with a small c, because the most important person in this relationship for us are our clients. So we take the back seat and always refer to ourselves with the smaller c to keep that in mind.
Melissa, thank you so much for coming. The work you do is incredible, and the advice you shared today is also equally incredible. Thank you so much.
Thank you, Charlie. It's really good to speak with you. Appreciate your interest. And it's important that we talk about abortion as normalized part of healthcare. It's really
I
needed.
agree. And I really hope to stay in touch, because you've been a great person to talk to.
I look forward to it.
Thank you. You can find out more about carafem services on carafem.org, and also UPIC Health, UPIChealth.com, to find out more about UPIC services. This has been a really enlightening interview. We're glad to have you here, like I said. So this has been CodeMed. I'm Charlie Kravits. Thank you very much. Bye.